We'd like to thank our funders who've provided support for the sessions that we run. All of these webinars and all of the work done at the Canadian Cochrane Centre is funded by CIHR and the institutes that you see listed there. Thank you for their support. The provision of Blackboard Collaborate itself, the software that we're using, has been provided by PAHO and the WHO Research Promotion and Development Group. We'd like to thank them for their support because this means that we can run these webinars for free around the world. Thank you to PAHO. Today's session is on reporting guidelines for equity-focused systematic reviews. That is the PRISMA-E 2012. Thank you for joining us today, and I'd like to turn it over to Jennifer and to Vivian to take on today's session. Jennifer.
Vivian, did you want to take a second to introduce yourself?
We're just going to give a second for Vivian's microphone to click in there. Jennifer, why don't you go ahead while Vivian checks that out?
Sure. Hi, everybody, and thanks for joining us today. I'm the coordinator of the Campbell and Cochrane Equity Methods Group and worked on this PRISMA Equity Extension that's just been published in October in PLOS Medicine. And over to Vivian.
It appears as though there's a bit of a problem with Vivian's microphone today. So while we get that sorted out, Jennifer, why don't you go ahead and perhaps you could start today's session.
Great, thanks, Erin. So Vivian will be speaking a little bit later, but Vivian is the co-convener of the Campbell and Cochrane Equity Methods Group. So thanks for joining us, and over the next hour we're going to introduce you to the new reporting guidelines for equity-focused systematic reviews, and we're calling these guidelines PRISMA-E 2012. So before we get started, we thought we'd just take a few minutes to find out a little bit about each of you, and we have a few questions we'd like you to answer. So these are yes or no questions, and you can use the polling buttons that Erin has just had us all try out. So the first question is, are you a researcher? So please answer yes or no. And we'll just take a few minutes to let everybody, or a few seconds to let everybody answer. Okay.
So we've just published those results to the whiteboard. You can see them there beside are you a researcher. If you want to continue with your next question, Jennifer.
So the next question is, have you ever conducted a systematic review? Yes or no? And can we have those results published them already, Erin? Okay, great. And the next question is, have you ever tried to write a paper on a systematic review? And we'll just take another second to allow Erin to have the results ready. Perfect. Thank you, Erin. And the last question on this slide is, have you ever tried to write a paper on an equity-focused systematic review? And can we have those results?
We've just discovered a new feature of Blackboard. Apparently you can only post 3 results to one slide. So we'll have to go with 32 saying no and 3 saying yes. So 32 said no, they have not tried to write a paper on an equity-focused systematic review.
Okay, great. Thanks, Erin. So we just have 3 more questions. The first one is, have you ever heard of the Campbell collaboration? And yes or no, please. Great, thank you. Have you ever heard of PRISMA, the standard PRISMA statement? Yes or no? Great, thank you. And the last question we have is, have you ever used PRISMA? Great, thanks, Erin. So it looks like a pretty good mix. So the last little exercise we have for you to get started is if you could please use one of the little icons that Erin showed us at the beginning to just mark on the map where you are located, just approximately, because it's not the best map.
And while folks are doing that, we'll give you just a moment. Christine has asked a question. Christine, did you have a question? Did you want to use the microphone? So no question from Christine at this point.
Okay, so we'll just let everybody finish marking the map. I think we're probably about done. So it's a good mix. Okay, I'm going to move on. So just want to acknowledge that this project received funding from the Canadian Institutes of Health Research and the Rockefeller Foundation. And just to tell you a little bit about our group, we are the Campbell and Cochrane Equity Methods Group, and you can find information about us on our website. And you can also get a printable checklist of the PRISMA Equity Extension from our website on the Equity Extension of PRISMA page. The Campbell and Cochrane Equity Methods Group was registered to insist that systematic reviews consider effects on health equity, and is registered with the Campbell and Cochrane collaborations. And our purpose is to ensure that Campbell and Cochrane systematic reviews include explicit descriptions of the effect of the intervention on not only the whole population, but also describe their effects upon the disadvantaged and their ability to reduce inequities. So the Cochrane collaboration's purpose, as I'm sure most of you know, is to provide relevant, accurate, and current research about health interventions, and Campbell's focus is on social, behavioral, educational, and international development interventions. So these are the co-conveners of our group. Mark Pettigrew is based at the London School of Hygiene and Tropical Medicine, and Peter Tugwell is based here at the University of Ottawa with Vivian and myself. The overarching goals of PRISMA-E 2012 are to improve the evidence base for equity-oriented policy by providing clear guidance on reporting for equity-focused systematic review methods and emphasizing the importance on reporting of health equity results. So the PRISMA Equity Extension has been published in PLOS Medicine, which is an open access journal. So you can access the reporting guidelines online. This is an old screenshot, so you'll just have to do a quick search for PRISMA to find the PRISMA Equity Extension. So this is the outline for today's talk, and I'm just going to get started with giving you a little bit of background about health equity, and then Vivian will take over to describe how these reporting guidelines were developed and why we need them. So our group uses the Margaret Whitehead definition of inequities, and that is that health inequities refer to differences in health outcomes which are unnecessary and avoidable, but are also considered to be unfair and unjust. So our group focuses on the health outcomes that would fall into the gray box in the bottom right corner of the slide. And when we're thinking about inequities, it's important to remember that disadvantages can occur across many factors that are related to more than just socioeconomic status and income. So to ensure consideration of these other factors, we use the acronym PROGRESS+. PROGRESS stands for place of residence, race, ethnicity, culture, and language, occupation, gender and sex, religion, education, socioeconomic status, and social capital. And the plus was added in 2008 because the PROGRESS acronym itself doesn't include all factors that may indicate disadvantage. So the plus is added so that other factors can be captured, such as age, disability, and sexual orientation. So you can use the plus category to capture any other factors that might be relevant in your specific context. There's increasing focus globally on inequities and reducing them. For example, in 2011, the Rio World Conference on Social Determinants of Health had a declaration that stated there's a need for evidence about effects on health equity. And in 2010, the Montreal Health Systems Research Conference stated that there's a need to consider health equity in producing the evidence base about health systems. So this indicates that there's increasing demand for equity considerations in systematic reviews. So for the purposes of PRISMA equity extension, we've defined an equity-focused systematic review as one that meets the following criteria: where the intervention is targeted at a disadvantaged population, where the intervention is aimed at reducing the gradient across populations, or where it's not aimed at reducing inequalities, but where there are likely to be important equity effects. And we estimate that approximately 20% of systematic reviews indexed in Medline meet one or more of these criteria. And now I'd like to pass to Vivian to tell us about why we need reporting guidelines for equity.
Okay, thanks, Jennifer. Sorry about not getting the microphone working earlier. My name is Vivian Welch. I'm one of the co-conveners of the Equity Methods Group. And I'll tell you a bit about why we felt it was important to develop reporting guidelines focused on equity and how we did it. Okay, so first I saw in the warm-up exercise that maybe about half of you have are familiar with the PRISMA reporting guidelines. So we want to give you a definition about reporting guidelines. These are a set of minimum criteria for how to provide a clear and transparent account of what was done in a research study. So they do not provide guidance on specific methods or how to conduct research. And the Equator Network maintains a library of all published as well as ongoing and in-progress reporting guidelines. And some examples you can see here are the Consort for randomized trials that many of you might know, the PRISMA for systematic reviews, and then the Strobe and Moose for observational studies. So the PRISMA statement is specific to improving the reporting of systematic reviews and meta-analyses. And you can find it online at prismastatement.org. It consists of 27 items that are listed in a checklist, so it can be used alongside a systematic review, and a 4-phase flow diagram, which is the diagram of how studies are included in the systematic review process. However, there's no guidance specific to equity-focused systematic reviews. So we set out maybe a few years ago to look at how effects on health equity are assessed in systematic reviews with the long-term goal of thinking about how to improve reporting of equity in systematic reviews. So the main body of this work was a Cochrane review on methods. And one of the findings I wanted to show you will probably not surprise many of you, is this study shows the reporting of population characteristics in systematic reviews. And we've laid it out according to the Progress Plus. I see that one person can't hear the presenter.
Yeah, we're taking care of that. If other people can. Yeah, we're taking care of that. If you could just speak just a little bit slower, perhaps, that'd be great. Thanks.
Okay, great. So this slide shows the reporting of population characteristics in this Cochrane review. We have laid this out according to the acronym which Jennifer described earlier, the Progress Plus. So you can see the primary studies are shown in orange, and the systematic reviews are shown in blue. And you can see for each of the items of Progress Plus that systematic reviews report probably less than 20% of the time the characteristics of populations across these factors. So for example, the LMIC is low and middle income countries, and this is reported in about 20% of primary studies as well as reviews. And the one factor which is reported the most frequently is sex and gender in both the primary studies and the reviews. Now, this pattern is repeated across many of the other method features of systematic reviews, such as the reporting of subgroup analyses about these factors and the reporting of judgments about applicability or extrapolation to other settings. So with this in mind, we thought there was scope for developing reporting guidelines, and we set out to develop reporting guidelines using the methods outlined by David Moore in an article in PLOS Medicine last year, I think, or in 2010, which lays out a set of steps for people developing health research reporting guidelines. And I won't go through his list of steps, but I think I'll cover how we met these steps. So what we've done is develop a flow chart of our methods, and I'll take you through this here in the flow chart and then give you a bit more detail about each of these steps later. So as I mentioned already, we conducted a systematic review about equity in systematic reviews. We also did a method study of systematic reviews to focus on how subgroup analyses were reported, particularly subgroup analyses about equity, such as differences across sex or differences across socioeconomic status. The next step we did was to apply the PRISMA checklist, the standard PRISMA checklist, to 3 systematic reviews that we thought met our criteria for being an equity-focused systematic review. So that is, we used a targeted systematic review, which was a systematic review of school feeding for disadvantaged children. We used a systematic review that was aimed at reducing the gradient in health effects between advantaged and disadvantaged, and that was a review on tobacco pricing and tobacco control. And we used a review where equity was not the main focus or outcome, but equity was certainly an important aspect, and that is a systematic review of lay health workers. Then from that review of the PRISMA checklist, we identified items that could be added to with to improve the clarity about reporting equity. And we used that to develop a survey on SurveyMonkey, and I'll tell you a bit more about the survey after this. We then held a consensus meeting with 23 participants where we aimed to have representation of both the users of systematic reviews as well as the people who conduct systematic reviews. So recognizing that some people wear many hats, the groups that we aim to represent were journal editors, funders, systematic review authors, particularly with a focus on low and middle income countries, decision-making organizations, practitioners, and methodologist statisticians. And we particularly aim to have a good representation of people from low and middle income countries, with 7 out of the 23 participants. And lastly, we did some pilot testing before publishing the reporting guidelines to improve the wording and the clarity of the checklist items. So the global survey was run from December 17th, 2011 to January 5th, and we published it widely because we wanted to reach both users of reviews and people who conduct systematic reviews. So we publicized it in the PLOS Medicine blog and BMJ blog, as well as a number of listservs and websites. And I wonder, Erin, if we could do a quick poll about how many people here participated in the survey. Is that possible? So I see the survey is up, so if, could people on the webinar indicate yes if you've participated in the survey or no? So it looks like mostly no, although we were very happy with the response rate. We had 325 people completed the survey of 400 who started it. And we're quite happy with the representation that almost half came from Cochrane or Campbell groups, which meant that almost half were outside of the Cochrane or Campbell groups. And we also, 20% were from an equity listserv and 20% from an evidence-based health listserv, and about half had 5 years of systematic review experience. So we felt pretty happy about getting a broad base. Now this slide is probably too small to really focus on the results. What I wanted to highlight is really if you look at the columns in the response of strongly agree and agree, that we had over 70% response for all of these items that we proposed, that people thought it was important to have additional items to specify methods and results about health equity. With that in mind, we held a face-to-face meeting with the people, as I mentioned already, journal editors, funders, users, and people who conduct reviews. And this was held thanks to the funding from the Rockefeller Foundation at their Bellagio Center in Italy. We had 20 participants, and we used a pretty inclusive approach to run these 2 days of meetings. We actually, in our PLOS Medicine publication, have appendices about the how we engaged all of the participants. Each person was assigned a role as a chair or a facilitator or a rapporteur. So we had a really rich discussion at this meeting. And from the meeting, we agreed with the 14 items that had been in the previous survey, but we really felt that they would be better outlined as 20 items. So the content of the items did not change, but we did feel that 20 items was more would be more clear. And these run across the 27 PRISMA items, from the title, the objectives, to the search, the results, and the applicability. So as Jennifer mentioned, we published this in PLOS Medicine in October this year. And the next 2 slides are very detailed and show the actual items. What I'd like to do is just show you how we laid this out, so when you read the paper, you'll know what how this works. On the left, you'll see the headings of the sections of a systematic review: the title, the structured summary, the rationale. And then in the second and third column are the standard PRISMA items that are suggested for any systematic review. And on the far right are the extension items that we propose for equity-focused reviews. And you'll see that for some items in the PRISMA statement, we suggested more than one extension. So for example, for the structured summary, we suggested extensions A and 2B to describe both the results and the applicability to disadvantaged populations. So this provides you with the last set of extension items here for the synthesis and applicability. What I'd like to do is take you through, I think, 3 or 4 examples, which are to give you an example of reviews that we think have followed these extension items. The first item is that we really felt as a group that if we want to improve the use of equity-focused reviews, we need to find a way that people can identify them. And we really felt as a group at the Bellagio meeting that having equity in the title is the only way to identify that as a major focus. So this is one example where equity has been included in the title. Can cost-effectiveness analysis integrate concerns for equity? And this also highlights that this reporting guideline is not only for Cochrane systematic reviews, but for all systematic reviews. Another example is the structured summary. Again, we felt that in the title and abstract, if they don't mention health equity, people may not be able to find them. So we really felt that results about health equity should be in the abstract, as well as any key findings about applicability. And this is one example of a systematic review on tobacco control, which looked at effects of smoking restrictions in schools and found they were more effective in girls, or they may be more effective in girls. Similarly, we felt in the analyses that additional synthesis approaches specific to the equity questions might need additional elaboration. This is an example where the subgroup analyses related to the effect of gender, as well as whether they were matched with the gender of the educators, was analyzed in a Cochrane review about diabetes. I think this is the last example, which is an example about the conclusions. Now, we recognize that a systematic review cannot provide the extent and limits of applicability to every population or every setting where an intervention might be applied. However, for the case of systematic reviews that do have a focus on health equity, we really felt that there is a need to describe the extent and limits of applicability to the disadvantaged populations of specific interest in that question. And this is one example from Systematic Review of Lay Health Workers by Simon Lewin and colleagues, where in the applicability they describe how they came about concluding that these interventions could potentially be extrapolated to other settings. So they've assessed the proportion of studies conducted in low-income countries, and they've also made an assumption about low-income groups in different countries sharing similar constraints. So I think I was going to hand over to Jennifer now. So now that you've seen the checklist, we want to ask maybe an open-ended question, whether people can suggest examples of systematic reviews that have reported equity well.
To answer Vivian's question, please feel free to send a message through the chat room, and Vivian will keep her eye over there and stay tuned for any comments that come through. So please feel free to use the chat room to send any responses.
I think I saw that Jackie is on the line, who is working on a systematic review. Are you still there, Jackie? I wonder if you want to put a comment about how you're thinking about equity in your review. I see that Jackie's typing.
Participant 115 has written in asking about healthcare services in different countries. 115, I wonder if you could elaborate a bit more on that.
So the healthcare services is that participant 115?
Yep.
Go ahead, sorry.
No, 115 hasn't written anything else in, Vivian, but we do have a response from Jackie, who said that, that she's used a lot of your work as examples of what to do.
That's great. Thanks, Jackie. So we're looking forward to working with Jackie on systematic review related to vision and equity in this, I believe it's health services for vision. I see that Davida has written in about drug studies and that information is not available on race and ethnicity. And we certainly recognize that sometimes the information is not available in the primary studies. One thing we want to do as a group within the Cochrane collaboration and a focus on systematic reviews is that in the past we have found that by encouraging systematic reviews to identify these gaps, it does prompt more primary research on those to fill in those gaps. And that's so the point of identifying a lack of equity reporting is still important in systematic reviews. I see that Sue Street has written in about Marion Doole's review on sex and gender-based analyses to cardiovascular disease. This was a nice assessment of the extent to which systematic reviews describe results by across sex and gender, especially in cardiovascular disease where there are differences between women and men. And they identified actually very little reporting of sex and gender. I see another one about interventions for domestic violence in different countries where there certainly could be equity issues. Okay, so I think those are some good examples, and we encourage you, if you'd like to get involved, to please contact us, and I think Jennifer will pick that up in the next slide. So Jennifer, can I hand over to you?
Sure, thanks, Vivian. For the next few slides, we're going to have a few more polling questions, so hopefully it doesn't get too complicated. But we'd like you to consider a systematic review that you're currently working on or have recently published, and answer the next few questions with that review in mind. So the first question is, did you or do you plan to use the PRISMA statement, the original PRISMA statement, to guide the reporting of your review? So could you please answer A for yes, B for no, or C for not sure?
And while we're waiting for that to come in, Jennifer, I noticed that Lindsay's written a question into the chat room.
Great, thanks, Erin. Lindsay has said a lot of the data on different sociodemographic characteristics is often missing, and do you think that many equity systematic reviews might be empty and have no included studies? Did you want to answer that one, Vivian? I'll just quickly let you know the responses to this question were 43% would plan to use PRISMA in their review, 4% only have said no, and 15% are not sure. So we'll come back to Lindsay's question in a minute. The next question I have for you is, would you use PRISMA Equity 2012 to assist in reporting equity in your systematic reviews? So could you please answer one from A to E? A is yes, I would use this checklist for every review. B is yes, I would consider using this checklist depending on the focus of my review. C is no, I would not use this checklist because I'm already aware of the items to include in reporting equity in my reviews. D is no, I would not use this checklist because it's not relevant. And E is unsure. Can you please take a moment to answer that question?
While we're waiting for that to come through, again, there are a few more messages in the chat room, Jennifer.
And Lindsay has added as a follow-up, does the equity extension account for the reporting of empty reviews at all? And we've also had Davida ask if demographics are missing and outcomes are not presented separately for race and gender. And we may be able to address these a little bit later when we discuss about how we hope the equity extension might change systematic review reporting, but also primary studies reporting. So maybe we'll come back to those just in a moment. And Erin has just published the results from this question, and 56% have said yes, they would consider using the PRISMA equity extension depending on the focus of the review, and 11% said yes, they would use it for every review. And then we had just 2% and no, I would not use it for use the checklist because it's not relevant, and no answers for C and E, and 29% didn't reply. The next question that I have for you is, overall, do you think using PRISMA-E 2012 to assist in would lead to you to report or conduct your review differently? And the answers for this question are A, most definitely, B, possibly, C, no, because I already include these items in my reviews, or D, no, because I would not include many of these items as they're not relevant, and the last one, E, is unsure.
Just a quick reminder to people to please use the functions at the top of the participant window to please select A, B, C, D, or E from the drop-down menu indicated by the little letter A. Unfortunately, your responses sent through the chat room won't come through the survey.
Okay, so the responses for this question are, the majority said B, possibly, 39%, 11% said most definitely, 4% said no, because I would already include these items in my reviews, and 11% said unsure. Nobody answered D, and 32% didn't answer. The final question that we have is, do you think using PRISMA-E 2012 in developing your review would improve the usability of your review for decisions about equity? Can you please answer A for yes, B for no, and C for unsure? We'll just give everybody a moment to get their answers in. Great, thanks, Arian. So the answers were 58% said yes, this PRISMA-E 2012 would improve the usability of the review, and 11% said unsure, and nobody said no, and 30% didn't answer. So these questions were asked in a recent survey that was sent around to systematic review authors by our colleagues in the Cochrane Public Health Group. And there were 149 respondents to the survey, and 84% said that they would use the PRISMA equity extension for their systematic review. So we're quite happy with these responses, and they match with basically the responses that we received from everybody here today. So we just quickly want to tell you about some of the next steps. As Vivian mentioned, one of the things we're working on is an explanation and elaboration document so that we can provide a little bit more information and detail about each of the items in the PRISMA checklist. As well, we'd like to provide some examples of good reporting to help give people an idea of what exactly it is we are expecting for the reporting of each of those items. And now that the PRISMA equity extension is published, we hope that these reporting guidelines will improve reporting of equity in systematic reviews, and that this will also eventually lead to increased reporting of equity in the primary studies. We aim to broadly disseminate these reporting guidelines to increase their uptake, and we'll also be writing to the approximately 200 editors of journals that endorse the PRISMA statement to ask them to consider endorsing PRISMA equity. And we thought we'd take advantage of your expertise and ask you if you could provide us with any suggestions on how we might improve dissemination and uptake of the PRISMA equity checklist. So if you could just write your ideas in the chat room on the left, and we'll see if that works. And if you can't think of anything at the moment, but come up with something later, you're welcome to send us an email.
Hi, it's Vivian here. I just thought I'd sorry if there's any noises from my daughter in the background. Just thought I'd address the question from Lindsay Shepard about empty reviews. The equity extension really, as you saw, has items across the range of conducting a review, so including having the questions about equity and the proposed methods for assessing equity. So even if the review is empty or the primary studies lack data to address the equity questions, it does provide the guidance that lack of data, should we say, is reported clearly. And I think maybe does that address your question, Lindsay? I see Lindsay has written in that workshops at the colloquia might help, and that's great. We did run a workshop in a health systems conference last month in Beijing, the health systems research conference, and certainly hope to run them in Cochrane. So I see a lot of comments here. I think I'll have to scroll back up here. Luis Gabriel, thank you for your suggestion about working with PRISMA-E. That would be great. We'll definitely follow up with you. Kristen M. has asked about bioethics societies. That's a great suggestion. I know that David Moore attends some of the ethics conferences, and one of the members of the consensus meeting is very involved in the ethics society, so we'll definitely follow up with that. That's Liz Wager. An online workshop can accommodate more people, so thanks for that suggestion, Milan. We're hoping these webinars will help get broader dissemination. Sue has a long comment about how to facilitate linking up with other individuals who would be interested in using these guidelines to do a systematic review. So the workshop at Cochrane is a great suggestion to have try and apply during the workshop. So we'll certainly take you up on that. And the Public Health in Canada, that's a great suggestion to get involved. We have we're actually based in Ottawa at the Institute of Population Health, where with two of the leaders in the Canadian population health research, Nancy Edwards and Ivy Bourgeau. So that's a great suggestion that maybe we could follow up with them about public health. And the standard titles in RevMen, that's a good idea for the Cochrane groups. Jennifer, did you want to discuss some of the training plans for the next year for the equity group?
Sure. Well, we're hoping to have another PRISMA workshop, PRISMA Equity Workshop at the Cochrane Colloquium coming up in September, and also we'll have some information available at the Campbell Colloquium and maybe some training there. And well, we're still working on getting an online training module, and we'll be also working with new reviews to help people one-on-one with using the PRISMA Equity Checklist within their review. And there's some more suggestions down here, which is one is to have an online training module and keep it up to date, a workshop at the Cochrane Colloquium, other webinars, and also Sue Street suggested this would be a good workshop to offer at the Canadian Association of Occupational Therapists conference. So we'd love to take it to a variety of conferences to reach all different audiences and help increase the training of PRISMA Equity that way. I'll just put this last slide up that gives Vivian and my contact information if you have any suggestions that you think of later to email us, or any suggestions of good reporting. And we also produce an Equity newsletter twice a year. So if you contact me, I can add you to our listserv, and then you'll get that that newsletter twice a year. And I don't bombard your inbox. It would just be those 2 emails a year with the Equity newsletter, so you can stay in touch with us and stay up to date. I'll just let Erin take over in case there's any questions.
Thanks a lot, Jennifer. I'd like to ask everybody to use your emoticons at the top of the screen to send a round of applause through to Vivian and Jennifer to thank them for today's session. You can send through a round of applause using the little emoticon buttons or a happy face if you learned something today. Could you please take a couple of moments, and I'm sending through in the chat room right now an evaluation form. I've just sent a link through in the chat room, and if you could please take a moment or two to respond to today's session, let us know how you felt it was. Your feedback is really important, and it does guide what we do with our webinars. A couple of other follow-up things are that anybody who registered and who signed in today will get a copy of the slides sent to you through email. So you'll have those coming to you shortly. We'll also send a quick reminder about the evaluation link. And we'll give just a few moments in case anybody would like to type through any questions into the chat room. While those are coming through, I'd like to let you know about an upcoming webinar series that we're presenting starting in January. This is a series on using evidence, how to use the results of Cochrane reviews. We're going to be hearing from John Lavis, we're going to be talking about health reporting, and we're even offering one of our webinars in French. So please do take a look at our website, and if any of those interest you, please make sure to register for those upcoming webinars. We'll give you a few moments just to see if there are any further questions that come through the chat room. And again, thank you so much to Vivian and to Jennifer for presenting today.